Joined by Dr. Molshree Gupta, senior fetal medicine expert from CK Birla Hospital. Thank you, Dr. Gupta, for joining us on CNN News 18 and sharing your perspective. My first question is, the entire scare that's been doing the rounds from a lot of our viewers and on social media is that this is a return of a COVID-like virus. Decode that for us, because many experts are saying the HMPV virus is nothing like what the COVID virus was.
Hi. First of all, I would like to say thank you for having me. So HMPV virus is a human metapneumovirus, which is not a novel virus. It was first detected in 2001. And since then, it has been circulating in the world, in the entire world. And we keep generally the infection peaks from January to March. And the infection is mainly more commonly seen in the age group of less than 5 years, and it is the older adult age group where it causes more severe symptoms. But in an adult, in the general public, the symptoms are just like a normal flu, and the symptoms are like mild respiratory infection, nasal congestion, cough, headache, wheezing. And if it gets severe, the symptoms of pneumonia, secondary bacterial infection causes, which can lead to hospitalization.
Right. And Dr. Gupta, given the fact that now there are 5 reported cases in India, what kind of measures should the common man take when it comes to protecting themselves from the HMPV virus and other related illnesses which are emerging given the alarm in China?
The first thing is we need not panic, and we should take measures just like we take regular measures in any viral infection. We should avoid going to places where there is a large group of people. We should avoid contamination because it is commonly spread through the respiratory secretions. So we should avoid. If we are going out in public places, we should use masks. We should avoid doing like disinfecting the surfaces routinely, and frequent hand washing, and especially if we are going in if especially with the kids, if the kid is sick, we should avoid sending them to school so that many other kids cannot, like, it should not spread in through the other to the other kids. And if especially to the pregnant women, we should avoid going out in public, especially without mask.
Right. And Dr. Gupta, we've all been trained by the COVID pandemic to take certain measures. We take those same measures given the
Yes,
pollution
yes.
in the national capital region where everyone's wearing masks whenever pollution spikes in the national capital region. Do you think the Indian citizen is adequately aware or has the adequate wherewithal to take these precautions? Or do you think that we've become extremely lax ever since the COVID pandemic has passed? Or are we well trained when it comes to dealing with these health scares?
So thanks to COVID, now everybody is aware, but the panic button starts very early. But the thing is, just like a regular flu, I think most of us are immune to it, so we need not panic. Especially, a study was done actually in AIMS last year, where 700 respiratory patients with respiratory infections were studied, and 4.6% of these patients actually had HMPV virus. So it is not a new infection. So we should just need to take regular precautions, and uh, we'll get past through it.
Right. Dr. Gupta, we also live in this era where we are glued to social media, and social media becomes the source of a lot of misinformation when it comes to
True.
health scares, when it comes to remedies as well. What message would you give our viewers when it comes to taking the right advice, taking the right steps to keep yourself healthy in the wake of this alarm?
So the preventive measures are needed when it comes to this HMPV virus or any of the viral infection. Um, the first and the foremost, drink plenty of fluids, warm fluids, keep yourself warm, avoid going out to a public place where there's a large group of people, and avoiding using mask whenever is needed. If you are sick, Don't go to your office or don't send the kid to the school. Keep yourself warm. And if any time, if you are having any symptoms which are getting severe, like tachycardia or tachypnea or fever, which is not settling down with the common medicines, what we need to do is consult instead of taking home remedies. Consult your doctor. If it's needed, get hospitalized, and they will take care of